Hi, I'm Dr. Dean van der Westhuizen, and today I'm going to just be walking through the workflow from in our software GoodX that we're using, which is both our PMA and electronic health records. We've had quite a few inquiries regarding having a look at how we use the software, what does the workflow look like through the practice. So today I'm wanting to just run through quickly a demonstration of how I use the software, how the patients interact, and how our staff use GoodX software to kind of optimize our workflows. So I'm going to hop into the system now, and then we're just going to go step by through, really just from a basic workflow from the patient arriving to the patient leaving and what happens within the software as we go. So let's hop in straight away. This is the diary, and the diary, like any diary, is got the list of patients for the day. These are all fictional patients, and essentially it would start with the patient who is booking an appointment. So they would phone, they would email, they would send a WhatsApp, however they communicate that with the practice, and then one would book a booking. So clicking on a time slot will bring up the booking. In there you would put the patient's name. I'm going to rebook this patient again, Peter Parker. And importantly, you need to say what appointment type it is. Is it a new patient? Is it a follow-up patient, etc.? I'm going to say it's a new patient. It's just warning me that he's been booked twice today. So at this point, what needs to happen is patients need to be sent information. And this is depending on the booking type. So you can set up, when it's a new patient, what gets sent to the patient. Do they get an email? Do they get an SMS confirming it? In that email, is there an attachment to information about their consultation? If it's a pediatric patient that you're booking, if the appointment time is a ped patient, maybe you want to send information around pediatrics, that they may be dilated. You may need to send in the pictures that they need to kind of become familiar with when doing a visual acuity. So you can customize what SMS and emails get sent out on that booking type. So there's customization on that side. When the patient is a new patient, they need to fill in their details. So at the same time, they can be sent a MyGC link where they can fill in their details before they come to the consultation. What would happen is if they do fill out their details, a little green box would appear next to the patient's name here. And so importing those details, it'll alert you that the patient's filled the information online, and you can import their details straight into the system, which would prevent them requiring to then fill in their details when they get to the practice. But it doesn't mean they have to. When they arrive in the practice, you also have the option for them to fill out their name and details on a clipboard if you choose, and then one of your staff can enter that manually into the system. Alternatively, when they arrive, you could say, well, you've got a link on your phone, would you like to fill out your details there? You could give them a tablet, ask them to fill out their details. You could have a kiosk. There's various ways of doing that, but obviously if the patient fills out their details beforehand, it's going to be a much smoother, seamless process as they arrive in the practice. At the same time that they fill out their details, they can sign your terms and conditions. That also gets sent out on the link. So it's their details, and they can sign the T's and C's. If they use the link, those T's and C's get pulled straight through to the patient's file on GoodX. So you're not having to then upload that or scan that and assign it to the right patient. It knows which patients filled in the details. It knows which patient has signed the terms and conditions. So that just makes it really efficient. Obviously, the type of appointment is really helpful. If you see, I've got a variety of different appointments here, and at a glance, you can see what's happening here. I've got 2 new patients. I've got a glaucoma follow-up. I've got a new pediatric patient, and I've got a post-op patient. So, and you can color code these how you want, and it really gives you a good visual representation of what's happening in your day. So that's the type of appointment, the appointment type. That's very helpful. And then you can see they're all this blue color, and that's the status, so the status of the patient. And this again is customized. If I click on any of these bookings, you can see I've got all the different appointment types, and over here I've got the appointment statuses. And I think the statuses are really critical in terms of workflow and how patients move through the practice. Again, you can colorize these. customize them, make them really how you want. And so they always start in this blue color here. So once the patient arrives in the practice, what would happen is they would be moved across, which you can use this block here to move them to arrived. So I can see Peter Parker's arrived. And this is helpful for everyone in the practice. I myself can see so-and-so's arrived, and I can see now Wonder Woman has also arrived. She's arrived in the practice. And so you start to get an idea of what's happening in your practice just by looking at the diary. The colors are really helpful. As they arrive, it starts a timer. You can see the patients have been here for a few seconds. And over time, you'll see this information will say a minute, 10 minutes, half an hour. And so you can see how long a patient's been waiting since they've arrived in the practice. And that's really helpful to kind of help triage and ensure you're not having left a patient that's arrived early or arrived late, and helps keep track of that, which is also very useful. So once they've arrived, someone obviously confirms. I mean, if they're a known patient, there won't be any paperwork. If they're a known patient, have they filled their details online, or do they need to be imported, etc. So you can then either import it via the medical aid card. If you use the medical aid number, you can import that. That's another way of importing the details through. And once they are registered and as debtors on our system, we mark it as ready for OA. Now that essentially means they're ready for the ophthalmic assistance. And this is really helpful. As you look at the diary, you want people to know what they must do. You know, what colors are they responsible for, and what colors are others people responsible for. So just by looking at the diary, you can see what needs to happen. So once this is a green color and it says ready for OA there, then one of my ophthalmic assistants knows now these two patients are ready to go through. And I also know what's happening now. There's a patient that has arrived, and there's two patients that are busy with the ophthalmic assistants. When they go through to have the investigations, in ophthalmology practice we have a lot of investigations, scans and things that need to be done, and so they get moved through to investigation. Now when they arrive, what would happen is they will have an RFID tag assigned to them. So what we would do, we'd click on the name, we scan their little card on a box. A little number will pop up on the screen, and it assigns that tag to that patient. It takes a second just to link that patient's booking to the RFID tag card. And then throughout the practice, we've got little RFID tag scanners, and as they go through, the ophthalmic assistants or myself or anyone can just tap that RFID tag on the wall in the room or in the desk, and it'll change the patient's status to the next status. So as the patient gets taken through, they will tap it on the wall. It'll move the status across to investigation because there's a scanner in the investigation room. As the patients are scanned on the wall, it gets taken through that they are now having an investigation done. That investigation will be an OCT, a visual field, etc., etc. The very powerful thing about this is that you will work with a work list. Now, what is a work list? A work list is when you take the patient's details, name, surname, demographic information, and instead of entering it in on the computer, it sends it directly to the machine. So once the patient gets taken into the investigation room, instead of typing the details on the machine, you click on the work list, you bring up the list, and you just click on the patient's name, and then you can just continue from there, and that's to all the machines. Multiple advantages to that. The first is you don't have any data capturing errors, which is really important. Often if it's done manually, a name is misspelt, and on all your machines you've got multiple names for the same patients or multiple entries. This means once you've entered it on the system the first time, it synchronizes between all the machines, and it's always the same, so those data capture errors are much less. And it's much more efficient for the staff because they're not having to enter all those details. So it makes it really quick to get the patient into the investigation room and get their scan done. Once their scan is done there, all that information is then exported to one cloud source called Harmony, where one can access all those scans. That means that you're not going to multiple different platforms to see your scans. Are you going to a network drive? Are you going to this piece of software, that piece of software? There's just one button that you press to access those scans. Once the patient has had their investigations, etc. done, they will then be moved across to ready in the waiting room. So you can see here, these two patients now have been done, they've finished, and they've had their investigations. If you are running more than one consulting room, with many ophthalmologists do, this will then be moved across to where that patient is. So, for example, we'll put Peter Parker in the back consulting room, like that. And what you will see here is I get a notification over here, and there's a sound notification linked to that as well. It says Peter Parker in back. If I put Bruce Banner, I'm going to click on Bruce Banner. Let's say he was taken into the front consulting room, and I will then get a notification saying Bruce Banner is in front. So immediately while I'm looking at the system, I get notifications for things that are relevant for me. The other staff will get notifications that are relevant for them. For example, at the end of the consultation, there may be things that need to be done, and then those staff members will be notified. So this means that while I'm busy consulting, or whether I'm busy on the system, immediately as soon as there's something that's relevant for me, I get notified. I can look at the diary and I can immediately see, okay, I've got 2 patients, they've had the investigations, they're in the rooms, they're ready to go, and now I can go in. So before I go in to see the patients, what's quite nice is from here, I've got a dashboard view, which I click on here. And this really helps give me a summary of what's happening with the patient. This is an experimental patient, so not all this data is accurate, but essentially it gives me the refractive information, the vision, the pressures on the left and the right eye. I can scroll through the previous assessments and plans in the past. This patient's had a Vaseline injection and an Ozzydex. I can see a scripting history, surgery history, if there's any diagrams that I've drawn in the past, if I've done any surgical planning. So before I go into the room to see the patient, I can get a good idea of what's happening. I can take a look at the history before going in. And so I have a really good idea of what's happening, and my mind's prepared, and I can really engage with the patient before trying to really figure out where are we with this patient and what's going on. When I go into the consulting room, I tap the box on the desk. What that does, it'll bring up, it'll move the patient into this view, like this. And so I can see the clinical view up here. So this is looking at the previous history, and I can look at the clinical view today, where there will be an eye-eval form where I can document the clinical findings. So the way it works in my practice, because we've got very competent ophthalmic assistants who are really excellent. Essentially, I encourage them to try and fill out as much of the clinical details as possible. Often these clinical details are copied from the previous consultation, because often they are same, so you can set that so that it just takes the previous examination findings and copies it to today, and then one can continue from there and make adjustments. And then when I see the patient, I can go through and review the clinical findings, document anything else. For example, I can say maybe the patient has cells in the anterior segment, or they have they've got keratotic precipitates, maybe it's a patient with uveitis. And what's also quite useful is as you click these things, it's assuming that if they have cells, they're going to have uveitis. So it's added the ICD-10 code for rhabdomyolysis. So as you click through, you can also get ICD-10 codes that are assigned at the bottom. But obviously nowadays, another powerful medium is the ability to make voice recordings. And then that allows you to dictate your clinical consultation, and then get it to generate that information. So I'm just going to show you how that works now. So as you can see here at the bottom, there's a create recording button. If I click that button, what it's going to do, it's going to start recording the consultation. You can see I can pause it, I can resume it, I can pause it again, I can resume it, and at the end of the consultation I can click stop. What that will do, you can see this is a 12-second recording I've just recorded, and you can see if I click on this green thing, you can see there is the audio transcription. You can add multiple audio transcriptions. So here's another one, so I can add another audio transcription. And as I talk, I can start talking about the patient. You can do it after the fact, you can do it during the consultation, depending on how you want to structure it. And essentially it does a recording of the consultation. I'm going to stop that, and now I've added an additional recording. At the end of the consultation, you will click this little button, which essentially brings up the AI side of software. There's a user prompt here, and then these are the individual fields that I wanted to complete with customized prompts for each of those fields. And what I would do, I would just generate. Now, because it doesn't have much information to work off here, because I haven't done actual consultation, it's going to really struggle to do it. But essentially you will click generate and it would then fill in these areas here. I'm going to do a very, very quick demo just for example. Let's just pretend it's a patient with uveitis. Okay, so let's do just a quick transcription. Patient presents with a 3-week history of painful left eye with redness and photophobia. On a clinical examination, patient found to have 1+ cells, 2+ flare, creatic precipitates of medium-sized non-mutton fat, no cells in the vitreous, some small areas of posterior synechia. Patient was assessed of having an acute anterior uveitis, patient to be started on topical steroids and cycloplegic mydriatic drops, and to return in a week's time for review. So that's really just a quick audio transcription. It's then going to convert it into text. I'm going to click on generate, and I'm going to generate the clinical notes. And this is really customizable. You can say which field do you want it to fill in. Do you just want it to do assessment and plan, and what do you want to include in it? Do you want it in bullet point form, etc. So you can see it's generated here. I'm just going to go accept responses for now and just show you just what it's put in the assessment block. So here it says OD none, OS anterior uveitis with the ICD-10 code, and over here the plan, it said topical steroid cycloplegic mydriatic drops and review in 1 week's time. It's put the follow-up date in for 1 week's time, and it's given a follow-up note. It says review in 1 week's time, no specific tests or procedures were mentioned because I didn't mention, and the booking type it's suggested as a follow-up patient. So that's just a really brief look at how some of the notes can be documented. I think that's what's important, is after the consultation what happens, and essentially there's a few things here. There's tasks that one can create, so those tasks can include P&B registration reports, and essentially this is how we communicate what needs to be done for the patient. So if I start here and I say we need to do a motivation for Lucentis for the right eye, and then I can assign that to a staff member. So I'm going to assign that. To myself, and I'm going to create a priority saying this is a priority. And you can add other information here if I want to type in other details around that. That will then create a task in the system for me or for another staff member to follow up on. So that means that you're not having to kind of try and remember what needs to be done for this patient. You can create the task, assign it to a staff member, and they can go ahead and follow up on that, and you can change the priority, making sure that important things are prioritized and things that are less important are lower down on the priority, so that you get to the important things first. So that's essentially the tasks, and we run most of our administration around tasks. We can talk a little bit about tasks a bit later. So at the end of the consultation now, you may have done a script as well. So script's obviously easy to create. There's this patient's had previous medication. I can re-prescribe this line. I can sign over here just with the pin, so that's the script to sign, and I can email it straight off to the patient immediately. So it's really quick to email that off if necessary, or you can print it out, or you can download it. The same with sick notes and other notes. A really important part of clinical care really is P&B registrations, which are often a bit of a headache. And I just wanted to show you quickly how easy that is to do. So if I, for example, made a task for a P&B, but what also you can do is, if you have a P&B code that is billed, you can have little stickers or tasks be created that ask your staff or reminders for staff to register the patient for P&B. And so I'm just going to show you what that looks like. We use PDF printovers, and it really takes a few seconds. So let's say we wanted to register this patient for diabetic retinopathy or glaucoma. Let's say a glaucoma for discovery. Here is the P&B form, and it's filled out the patient's details. You can see there that's filled out. This is all pre-done. Here's the signature for the patient. You just need to click on that. We give them a tablet and they can sign that, and now the patient's signature is on the P&B form. And then it's really easy to then email this off to the medical aid. So really it takes a few seconds to register a patient for P&B. From here you can obviously click email, and you can have a preset email set up with with your PMB email address for the schemes. So to set out a PMB registration. So that's also very powerful. That's more on the admin side. So once I'm finished with the patient, something may need to happen with that patient. So for example, at the end of the consultation, let's say this patient had DME and I actually wanted this patient to get an injection. So I will click on waiting for injection. When I do that, it changes to this color, and then it notifies the staff member that we assigned to that this patient needs something done. This patient, in this case, needs an injection. And so that staff member will get a notification in their system saying patient needs an injection, and then I'll ask the patient to take a seat in the waiting room. The patient then will be prepared for that injection or for a laser procedure or whatever the specific thing that you want done. And then I will continue to see Bruce Banner. I'll go in, I'll look at his dashboard, have a look and see what details, his previous assessments and plan, what we've done for him, his script, etc. We'll go and do a consultation for him. And at some point, maybe I'm busy with this consultation, at some point, once Peter Parker is ready, they'll move this status across to ready in theatre. What that'll do, it'll bring up a notification for me saying the patient's ready in theatre. Maybe in the meantime, this other Peter Parker has arrived, or maybe he's been put in the back consulting room, and so I get notified that the patient's ready. So as your day goes through, you can immediately look at the diary and say, okay, well, here's a patient that's ready for injection. This is a patient I'm busy consulting. There's a patient in the other consulting room, and there's a patient that has arrived, and she's been here for 18 minutes. So this really, really is powerful if you set up your statuses and your booking and appointments properly, and it helps to communicate to all the staff what's actually happening with the workflow. Add the RFID tag boxes so that you can tap as you go. It helps to ensure that when you tap on the box, it knows which room it's in, and so it knows that this patient needs to be moved across to whichever status the patient is in. And then at the end of the day, for Peter Parker, the patient's been prepared for the injection. After I've done the injection or done the procedure, I'll move it across to finished. Now that the patient is finished, there's a notification for the person who's doing the billing, and they can then bill this patient. Once this patient is billed, this will then go to a purple color. I'm not going to bill this patient because there's actually no billing. Here we go, it'll go to that status. And so at the end of the day, what you want to look and see is that all your patients are billed. You want to see these going purple as the day goes on. This patient, let's say you've consulted them and now you've finished, they didn't need a procedure. This patient would then go through to the billed status like that. Okay, and now I can see there's a patient that's arrived, but there's some hold up here. No one's picked this patient up or hasn't been investigated. You can investigate this. And this patient actually hasn't arrived. The patient is running late. Maybe we can follow up and phone them and see, okay, let's see where that patient is. So that's essentially there. From there is your tasks. So in here is where you create all the tasks. You can prioritize them. You can put different columns and phone calls or follow-ups, etc. So you can track what needs to be done for the patient after the fact. So one of the other things that is quite powerful, besides the RFID tag boxes and the clipboards for tapping as patients move between places, that obviously changes the bookings in the diary here and the statuses as you go along. But what it also can do is if you have light boxes, which are made by GoodX, which can sit anywhere, you can have indicator lights there, which can be green or blue or orange or red or whatever, that can help indicate what's happening. For example, outside a consulting room, you can have a consulting room being green, meaning that room is open, it's free, no one's using it. When the status goes to in consultation or in front or left, or depending on what your status is, that light can go red, showing that room is being used, and don't disturb, don't go in that room, don't try and load a patient in that room. The same way in your laser room, maybe when you're busy with the patient, the light comes on above the door, or a procedure room, that as the status changes, it automatically changes the light above that door to to indicate to staff or people who maybe aren't looking at the diary at that time what is actually happening in that room. So you may have a call out, so you may have a status where you want to call a staff member and you're saying you need attention, you're in the consulting room and maybe you need someone to bring something or to help with something. You can maybe have the status that changed that light to a blinking blue light, for example, and then that can indicate to staff that you need help in the room, etc. So there's lots of ways of setting it up, but I think this is really just in terms of flow in the practice, kind of thinking about the statuses and thinking about the colors, and then combining that with lights outside the room, RFID tags, etc. It helps to create a really efficient workflow. Combining that with tasks, that as you go through that you can assign tasks, things that need to be done, that's also very powerful. And then one last comment is obviously because this information is all digital, all your information is digital, you can have audio transcriptions, etc. You can then use AI to further things. So I just want to show you how that works. Just one last thing to show you. So on the clinical side, you saw we did the consultation for this patient. I actually didn't save it earlier, but we've got an audio transcription so I could regenerate the clinical notes again if I wanted to. But what's really powerful is from this point I can do a variety of things like generating reports, generating motivation letters. Let me just accept this again, so it's put in the details here. Now let's say I wanted to do some form of report. So I'm going to click on reports here and I'm going to go down here to let's do a feedback and you can see here's the prompt, these are the fields, and I'm just going to click generate. And I'm just going to show you what it's going to put in here. So this is essentially a letter that I'm asking it to generate. It's using the context. Obviously this may not be perfect because I haven't done put a lot of information into the consult, but here it's generated a letter. I haven't actually pulled in any of these values for today, so it actually doesn't have the uncorrected, best corrected IOP, but it's basically said clinical exam reveals 1+ cells, 2+ precipitous medium size, non-mutton fat, no cells in the vitreous. So it's taken the consultation and created a letter, and so this is just an example of using a source of your clinical notes. And I just want to show you one thing I forgot to mention was, I'm just going to do that again. Here we go, is when you generate anything, you can choose what source files to use. You see I've got the transcription, the audio transcription, I've got the actual examination, I've got the script, I've got the PMB. So I can say I wanted to use or not use certain audio transcription or certain files to generate whatever content, and these prompts you can create whatever you want, and so sky's the limit in terms of what kind of report you want to generate and templates, and so from an administration side, once your data is in a digital form, you can harness the power of AI, which is already in the system, to kind of really supercharge your system and really help with administration, etc. So that's really a speed through demo of kind of the workflow and kind of how we use GoodX in the practice, in the workflow, and practically how patients move through the system to try and ensure we provide a great service, be efficient, make sure administration, we are on top of administration, and make sure the patient has a very seamless, smooth flow through the practice, not wasting their time and not wasting your staff's time or the doctor's time. But yeah, so thanks for listening. I hope that was helpful. I hope that was insightful. And yeah, reach out if you do have any questions. But yeah, I think that it really has been a practice changer for me. So I'm hoping it also adds value to you.